Thank you. Senator Munson, suivi de la sénatrice Petitclerc.
Followed by Senator Petitclerc.
Questions for the two ministers, and thank you for what you're doing. We know you're trying and your best, but a CBC story just this morning. Canadians desperate to return home from abroad in the face of the pandemic are easily circumventing the travel screening. This is, and they talk about facts in this story. And Minister, China almost flattened the curve, and then people who returned home easily probably circumvented whatever they're trying to do of people coming back to their country. How can you stop this? What other measures do you have to make sure that the person who gets on that plane is not carrying the disease back to this country?
I'll begin and then turn to my colleague to speak from the health perspective. But we put a number of measures for international travelers in place. And first of all, and foremost, the first line of defense is the air carrier itself. And so we have issued directions to air carriers who are flying into Canada that they have a duty of care and a responsibility to check for symptomatic passengers boarding their planes, because once they get on the plane, they can put other people at risk. It's not merely an issue of asking the questions, because we do know overwhelmingly the majority of Canadians are very responsible and conscientious and will tell the truth, and some will not. And so we also ask those airlines and their flight crews to make observations and to identify people who appear to be symptomatic. That's identified to our officials before the plane lands. Those individuals are met right at the gate and separated from the rest of the arriving passengers and directed towards appropriate health interventions. We also require that everyone acknowledge a question, that they are asked if they are symptomatic. They have to provide an answer. They also are asked and told that they should enter into a 14-day period of self-isolation. They have to acknowledge that. We have officers roving through the areas of the passenger arrival areas to make observations around symptomology and to make references to refer people who are symptomatic into the appropriate health interventions. And so it is, we are not conducting health examinations at those sites, but we are screening them for arrival for their being symptomatic, and we are also giving them direction and instructions on how the measures that they must take in order to prevent the spread of the illness.
To the Minister of Health, why aren't we having health examinations? When I traveled in Africa many times, you can sometimes walk up and they'll take your temperature as you walk up. This is before any pandemics. I think this is a very serious situation.
Thank you, Senator. First of all, let me just say this is a very sneaky virus. I mean, the challenge with the virus is that it can present as very mild without a temperature at all. The variety of symptomology depends on the individual, and it is extremely difficult to detect illness. And sometimes people have such mild symptoms that they may not even know they are having, they have the illness. And that has been the challenge with this virus from the very beginning. The best evidence that we have is, in fact, drawn from the time of SARS, where some of you may remember there was a use of thermometers at the border. Not one case, by the way, was detected using that technology. And so how we use our resources in a time like this is critically important. Of course, we have Public Health Agency quarantine officers at all of the airports. We've doubled up on staff, tripled up on staff, support CBSA when they identify someone with symptoms. Those people are isolated from other travelers, asked additional questions, funneled to public health if necessary. That work is happening. But I will say that one of the things that we are obviously concerned about are people coming back to Canada who are not taking this seriously, the need to quarantine for 14 days, the need to stay in isolation for 14 days, which is why, as of midnight tonight, that will be mandatory for all returning travelers. Too many people, especially if they're coming from countries that have minimized the issue of this virus, and we know many people are coming from winter homes, for example, that may have been hearing different kinds of news around the severity of this illness, are not taking this seriously. And so as of tonight, it will be mandatory for anyone returning to the country to isolate for 14 days under the Quarantine Act. Also not to isolate when in the same home where there is a vulnerable individual, and not to take public transportation to get to that place. The Public Health Agency of Canada will be supporting people that are in the circumstance of not having a place to stay and or for not having transportation that's private. We need Canadians to take this seriously who are returning to this country. Even if they are asymptomatic when they get off the plane, it is extremely important that Canadians understand that for the safety of their family and their communities, that they take the public health advice and now requirement to stay at home for 14 days. And that means not visiting friends and family.